New at 4:30, doctors are starting to turn away from insurance in favor of direct pay systems.
Yeah, it's part of a growing trend as there are now 7 direct pay practices in Hampton Roads. Emily Harrison joins us. And Emily, this number is slowly increasing.
Slowly but surely. Anyone who has had a health scare or needed to go get a checkup can see pretty quickly how the bills can stack up. And it's going to be the reason why some doctors say that they've had enough and are setting up their own direct pay system through a monthly service rather than use insurance.
Dr. James Tinsley with Lighthouse Direct Primary Care says he's noticed the uptick himself, now limiting the amount of patients he sees per day because of rising demand.
I'm seeing the critically ill people now. That's why I'm busy. The healthcare system has failed.
Tinsley says he expects the number to only increase by January, as Medicaid cuts are expected. That's when enhanced federal matching funds will no longer be available under the Affordable Care Act, leaving some patients with more healthcare bills than what they might have initially believed. Tinsley says he tries to offer an alternative.
Not only do we have to be a good doctor, we have to make it affordable for our patients. One lab costs $200. That same lab here I get from my patients for $4.
And Dr. Tinsley is not alone, as at least 6 other direct pay practices have started in Hampton Roads in the past 10 years. Dr. Emily O'Rourke started hers in 2018.
We're more tapped into what cash prices are for things, because I didn't know at all what things cost. When I was an insurance-based doctor, you may go to get an ultrasound at an outpatient imaging center, and it is around $100. And if you go get that same ultrasound in a hospital, it might be $1,000.
According to the Kaiser Family Foundation, around 1/3 of adults say they have put off necessary care because of the price. And nearly half of adults say it is difficult to pay the price for unavoidable procedures.
And that's incredibly sad that people are fearing not the diagnosis, but the bill.
No, both doctors Tinsley and O'Rourke are still urging everyone to hold on to their health insurance, as you never know when you may need it, especially if it requires specialized surgery or specialized care. Emily Harrison, 13 News Now.
All right, Emily, thanks. And according to a study with the National Library of Medicine, researchers found that pairing a direct primary care membership with a high deductible insurance plan could lower health costs by more than 30%.